A 13-year-old male presents with left arm pain after a fall. I am showing you the frontal radiograph of the left shoulder and upper arm. Describe the findings.
Right, so the radiograph demonstrates a well-defined solitary lucent lesion located centrally within the proximal metaphysis of the left humerus. The lesion has a narrow zone of transition with a thin sclerotic rim, thin overlying cortex, and mild bone expansion. Importantly, there is a pathological fracture line extending through the lateral cortex of the lesion. A small fractured cortical bone fragment has migrated dependently to the bottom of the cyst cavity, representing a pathognomonic fallen fragment sign. A mild periosteal reaction is visible adjacent to the fracture site, which is reactive in nature.
What is the diagnosis, and what are the main differentials for this lucent bone lesion?
The diagnosis is a simple unicameral bone cyst of the proximal humerus with a pathological fracture. The primary differential diagnosis includes an aneurysmal bone cyst, a giant cell tumor, and fibrous dysplasia. An aneurysmal bone cyst typically presents as an eccentric, highly expansile blowout lesion rather than the central mild expansion seen here. A giant cell tumor occurs in older patients after growth plate fusion, is eccentric, and extends directly to the subarticular articular margin.
I'm showing you 3 comparison images: a pediatric pelvis radiograph, a femur MRI, and an elderly pelvis radiograph. Describe their findings.
The pediatric pelvic radiograph shows a classic aneurysmal bone cyst of the left iliac bone, demonstrating an expansile, multiloculated lucency with a narrow zone of transition. The Sagittal T2 weighted MRI of the femur shows a well-defined, hyperintense, fluid-filled cystic lesion in the proximal femur metaphysis, typical of a simple bone cyst. The elderly pelvic radiograph shows aggressive, widespread lytic metastases from breast cancer with cortical destruction and a wide zone of transition. There is a pathological fracture of the left femoral neck in this metastatic case, illustrating the features of an aggressive lesion compared to the benign simple bone cyst.
Explain the epidemiology, typical location, and clinical presentation of simple bone cysts.
Simple bone cysts are benign, fluid-filled lesions that occur predominantly in children and adolescents between 5 and 15 years of age. They have a strong male predilection, with a male-to-female ratio of approximately 3:1. About 75% of these cysts are located in the proximal humerus or proximal femur metaphysis. They are usually asymptomatic and found incidentally unless a minor fall causes a pathological fracture, which presents with acute pain.
Explain the pathophysiology of the fallen fragment sign and its diagnostic specificity.
The fallen fragment sign occurs when a cortical fragment from a pathological fracture falls dependently through the fluid-filled cyst cavity. This sign is highly specific for a simple bone cyst, as solid bone tumors like giant cell tumors or fibrous dysplasia would support the fragment, preventing it from falling. As a radiologist, I would recommend referral to orthopedic surgery for fracture management, noting that these cysts often spontaneously regress after skeletal maturity. Surgical curettage and bone grafting or steroid injection may be considered if the cyst is large or causes recurrent fractures.